when you have to speak, just unmute yourself for that short period of time. If you're on iPads or laptops, please keep your phones away from you because the signals can cause a lot of disturbance. I think without wasting any more time, I call the meeting to order. The Secretary of Lions Club of Gateway, Lion Falguni Sheth, will now give us the flag salutation. Lions, please rise for the same. Falguni Sheth, over to you.
Thank you, Zenobia. We salute our national flag and pledge our allegiance to the same. Its honor and its glory depend upon the zeal and the assiduity which each one of us shoulders for citizen. We in the letters of gold, in the fame of our. We declare our unceasing loyalty to our national flag and maintain that its cause shall be our cause, and each individual amongst us shall make genuine effort to add to its luster and glory and make it fly proudly and high, the committee of nations. Please be seated. Thank you.
Thank you.
Falguni. Now the President of Lions Club of Shivaji Park, Dr. Saroj Ben, will give us the welcome address. Saroj Ben, please unmute yourself.
Okay, you unmuted, Saroj Ben.
Hello.
Yeah.
Hello. Yeah. Hello. I'm happy to announce that our past international President Lion Ashok Bhai and Kokila Ben may have joined today. So, respected past international President Lion Ashok Bhai, Kokila Ben, presidents and Lion members of all 5 clubs, keynote speaker Dr. Akshay Mehta, Dr. Snigdha Mehta, Dr. Sampada Kher, guests and friends. It is my proud privilege to welcome you all at this unique meeting. Special welcome to Dr. Akshay Mehta to accept our invitation to give a talk on romancing the heart. I welcome President of Vaikhala, Lion Firoz Katrak, Lion Usha Tendulkar, President of Gateway, Lion Zenobia, President of Babulnath, and President Keun Daji of Kingsway. A special mention about Dr. Snigdha Mehta for making this meeting successful. Let me tell you, she is the better half of Dr. Akshay Mehta and a well-known physiotherapist specialized in women's health. Sometimes we do not know heart is pumping fast or slow. But today, after Dr. Mehta's presentation, it will pump normal. Interesting to know about a rare case of a lady who was born without the heart. But thanks to the present technology, now she is 35 years old, living on portable heart machine. So it is interesting to know something new, especially on romancing the heart and its function. Dr. Mehta is going to promise you to handle your heart with care, treasure it and love it. Thank you all, and I welcome you, hearty welcome to all of you. Thank you.
Thank you,
Zenobia.
Dr. Saroj Ben. And now I invite the President of Lions Club of Vaikhala, Lion Firoz Katrak, to introduce our chief guest and keynote speaker, the cardiologist, Dr. Akshay Mehta, who will be presenting us the topic, Romancing the Heart. So Firoz, over to you.
Thank you, Zenobia. Good evening, dear Lion members and friends. Today, in these uncertain times, and especially so because of this pandemic, we all need to take care of ourselves, and especially our vital organs. Heart is the most vital organ, and who better to share us insights than an interventional cardiologist? Mehta, a leading interventional cardiologist of Mumbai, it is my proud privilege to introduce you to all Dr. Akshay Mehta. Dr. Akshay Mehta has been practicing at Juv Vilaypale scheme for 30 years plus to Nanavati Super Specialty Hospital, Breach Candy Hospital, Holy Family Hospital, Bharatiya Arogya Nidhi, and BSCS MG Hospital. He has always been a meritorious student, having received the government open merit scholarship and national scholarship. After his graduation and post-graduation from Sage GS Medical College, that is KEM Hospital, Dr. Mehta obtained his DM in cardiology from TN Medical College, that is Nair Hospital. To Dr. Mehta's credit is, and it's a long list, please. He's a fellow of the Society for Cardiovascular Angiography and Interventions, USA. Is a member of various national and international bodies such as Cardiological Society of India, American College of Cardiology, and American Heart Association. He is the associate editor of cardiositeindia.com, a web portal for cardiologists in India. He was invited to be a section editor for cardiology. He is Secretary of Academy of Cardiology at Mumbai and responsible for its annual conferences. He has published numerous papers in peer-reviewed journals and participated in many conferences as faculty. He was the organizing committee member of the International Summit on Coronary Artery Disease and Cardiovascular Interventions 2005. He was invited to do a medical audit for CAT and intervention cases at Bhaktivedanta Hospital, Mira Road, Mumbai. He was a reviewer, cardiology section in the Journal of Obesity and Metabolic Research, Journal of Midlife Health. Has a popular and educative YouTube channel. He has also co-authored several books for cardiologists. That is, 1, Cardiac Catheterization and Imaging from Pediatrics to Geriatrics. 2nd, Coronary Angioplasty, Evolved to Perfection. 3rd, Yearbook of Cardiology 2016. 4th, Yearbook of Cardiology 2017. And 5th, Cardiology Review 2018. 2 of his other publications are Kindness Helps Healing, a booklet on kindness in hospitalization by organizations, Kindness Unlimited, and he has patient awareness books on behalf of Rotary clubs. Dr. Akshay Mehta today is going to speak from his heart about the heart. So request all of you to please give him a patient hearing, because he's going to speak from his heart and you listen from your heart, because at the end of the day, we are all going to take care of our heart. So over to Dr. Akshay Mehta.
Thank you, Feroz. Everyone, please welcome Dr. Mehta with a loud round of applause. At least we can see everyone clapping if we can't hear.
Thank you.
Zenobia? Hello, Zenobia?
Yes, Sarojben.
Can we give little instructions to the participants?
Sure.
Sarojben, unmute yourself. We can't hear you.
Hello?
Can the host
you can tell.
Can the host mute everyone?
Can you hear me now?
Yes, you can convey whatever you want to the participants.
Yeah. Okay. So, Sumit, can you please forward the phone number of Sonal Vakil and Snigdha Mehta on the screen so people can ask on WhatsApp whatever questions they want to ask on WhatsApp.
So otherwise, people can put their hands up and submit.
No.
That will create a problem.
Okay,
Zenobia.
fine. Okay.
So
They will put the
Put it on the
screen
chat
with-
group. We can put it on the
Also-
chat group also.
also, can I request everyone to stop unmuting themselves, because it's going to cause disturbance. Like only like Dr. Akshay be on unmute. Otherwise, everyone
Sure.
please ensure you are on mute.
Sure.
So people can put up their questions even on the chat group.
Yeah, they can.
So there it can questions can be seen. Should we now request Doctor to please start his presentation? Over to you, Doctor. We're all muting
please.
us.
Okay. Yeah. Thank you very much, Lion Zenobia, Lion Firoz Katrak, and everybody. And good evening to everybody. And I hope I am being heard. Can you hear me? Yeah, okay. There are some thumbs up signs. Okay. Hope you're all in good health. And first of all, of course, I would like to thank Dr. Saroj Ben Sangvi and the Lions Club of Shivaji Park, along with the Lions Clubs of Baikala and Gateway, Queensway, and Babulnath for inviting me. I'm also very happy that the Lions International past president, Ashok Bhai Mehta, Ashok Kaka for me, and Kokila Kaki are probably present here, and we are blessed by their presence. No, before I joined medical college in my teen years and college years, I thought the function of the heart was only to flutter at seeing a beautiful girl. But when I joined medical college and dissected the heart, learned about its function, all the romantic thoughts about the heart disappeared, and heart came to be seen as just a simple muscular pump circulating blood in the entire body. Then life turned a full circle in clinical practice. When listening to patient stories and examining them, I realized that heart is not only a muscular pump, but a center of emotion, being impacted by our thoughts, feelings, and way of life. So I think it is time we took care of this delicate organ. It is time that we started a romance with our own hearts. So I think let us go to our presentation. I will just share my screen, please. And we will start my talk with a small video clip. So, romancing the heart. I would like you all to see this video clip and tell me or tell yourself, what is this incident? What medical problem is this? Probably this is some Sensex news or something, right? Two of them collapsed. So if you say this is a heart attack, then I'm afraid that is not correct. This is what is known as cardiac arrest, which is different from a heart attack, and which we shall see a little later on, because the presentation and the treatment is different from both the conditions. So this is the first thing that you must know, that a cardiac arrest is different from a heart attack. So what is a heart attack? So let us understand this in a fundamental way. Now, as you may know, all of us know this, that heart is a muscular organ which pumps blood, receives blood, and pumps out blood. The upper two chambers are the receiving chambers, and the lower two chambers are the chambers which dispatch centers. And out of these two lower chambers, it is this left ventricle, the LV, which does the maximum work because it has to pump blood to the entire body. And because it does the maximum amount of work, it suffers also, it requires also a lot of nutrition. To make it very simple to understand, let us see a simple diagram. Now this, supposing this is a left ventricle, we are seeing just the one chamber which suffers from heart attack most of the times. Now, as you can see, with every heartbeat, this muscle of the heart or heart muscle, it contracts and pumps the blood contained in the cavity through a large tube called the aorta to the entire body. So with every heartbeat, the heart muscle contracts and pumps out this blood. Now, like every muscle in the body, even the heart muscle requires oxygen and nutrition. उसको भी खून चाहिए खुद को. तो ये खून कहाँ से मिलता है? Through the branches of this aorta called coronary arteries. Unfortunately, though the heart contains blood in it, that blood cannot be directly supplied to the heart muscle. If that was so, there would not have been heart attacks. But the blood supply is through these coronary arteries. ये हमारी lifeline है. Or so these are the lifelines which supply blood to the heart muscle. And you can see how they are branching over the surface of the heart muscle and supplying heart muscle with blood. Okay, now the problem starts. We were born with the artery. Suppose you cut open the coronary artery, its passage is open, smooth, under lining bhi ekdam smooth hai. And here if you slit it open, kholenge to bhi it is very smooth. But in some people over the years, due to various factors, fatty deposits are formed inside the heart, inside the tubes, these coronary arteries. And these fatty deposits gradually increase and cause total obstruction. Now, if it is a gradual process which occurs in some people, a time comes when the narrowing is so severe that the passage of the artery allows only that much blood which is enough for the heart in resting condition. But when the heart exercises or is emotionally stressed, the amount of blood supply is less than the demand that the heart muscle makes. The heart muscle requires oxygen and nutrition, and the supply is less, and then that is the time they get a chest discomfort called angina. So in some people, this is a chronic process. Actually, these people are lucky because they have a warning sign of angina when the process is slow. But in many people, despite the fact that the blockage is mild, which does not give rise to any symptoms, which may not be picked up on an ECG also, many times this mild blockage suddenly becomes severe and almost total. And we realize that many people who are comfortable reading a newspaper suddenly started getting chest discomfort, pain, and a heart attack. So what happens in such a person? So this is a very common scenario, and patients with even mild blockages can develop complete blockage due to this process which I shall show you. Now, what is this process? Now, this is a blockage which is only 50%. That means only 50% of the diameter is narrow. There is a 50% passage which is open, which is allowing blood. And such a patient does not have any symptoms. But due to some factors like emotion or exertion or diet, sometimes this fatty plaque ruptures, and like a boil on a skin, is exactly like a boil on a skin, but this is inside the artery. The rupture causes the flowing blood to clot over there. And this clotting can occur within minutes and can completely block the artery. So a 50% block became 100% within minutes. And this is what happens when the artery gets totally blocked and there is a heart attack. And what happens? You can see that if there is a blockage here, the portion of heart muscle which was supplied by this many arteries gets damaged and slowly becomes dead. So the muscle becomes dead. And this is a heart attack, or what is known as myocardial infarction. And what happens when a portion of heart damages or becomes dead? There is chest pain or discomfort. The heart is beating. Patient is conscious. There is a 25% chance of cardiac arrest. That means stoppage of the heart in the first hour after a heart attack. But many cases, 50 to 75% of cases, reach the hospital with the chest pain. So heart attack means chest pain and a conscious patient. And it is different from cardiac arrest. So now, one important thing that you must realize is that though the blockage in the artery, as you can see here, occurs within few minutes, and the blood flow stops in a few minutes, the ensuing damage, जो damage होता है heart को ये blockage की वजह से, वो धीरे धीरे अंदर से बाहर फैलता है. It spreads in layers in the heart. This is the heart muscle, and this is the cavity of the heart containing blood. And the heart muscle, when it is damaged, it damages slowly in layers. First the inner layer, then the middle layers, then the outer layer. And this process takes 8 to 12 minutes. And this means that this gives us a window of opportunity, which means that if you open the artery within the first hour, the damage, resultant damage will be less. But if you open the artery after 12 hours, then a lot of damage would have already been done. तो ये बहुत important opportunity है कि हम ये नली को खोल दें जितना जल्दी हो सके उतना. Then the damage will be minimized to the heart muscle. That is why we mention this golden hour. The first 1 or 2 hours में one must reach the hospital. And on reaching the hospital, what do? We open the artery, either by balloon angioplasty or by giving a clot dissolving injection. Of course, balloon angioplasty succeeds in 99% of cases, whereas injection, which dissolves the clot, succeeds in dissolving the clot in 80% of people. So generally, if it is possible, it is always better to do angioplasty for such patients of heart attacks. So I hope till now things are clear. So as you can see, if the blockage is removed in time, the person is left with only minimal damage, and the complications like heart enlargement due to severe damage is prevented. So complications are prevented if the artery is opened in time. So summarizing, the heart attack or a myocardial infarction is due to blockage of an artery, which causes death of a portion of the heart muscle, and the resulting symptom is chest pain. So important thing is to recognize it early and act within minutes and hospitalize the patient so as to open the artery, and also in case there is cardiac arrest on the way or in the hospital, to treat it, because cardiac arrest after a heart attack, a person can be immediately revived if a shock is given, which we shall see later on. So the first 1 or 2 hours of a heart attack are extremely important to recognize and act within minutes to open the artery. So now the two important things are recognition and action. Now, how do we recognize? Now, question for you is, heart attack starts as severe pain in chest, true or false? Well, if you say it is true, it is not correct. So many times we have a preconception that heart attack means severe pain in chest. No, it starts as mild or moderate pain or discomfort in chest, which increases in minutes. Yes, it definitely increases, becomes more severe, but it starts as a very moderate pain and it has to last for more than 15 minutes. Usually it feels like uncomfortable pressure, squeezing, tightness, or burning. It feels like a tight bear hug, जैसे किसी ने हमको जोर से दबाया हो, या एक हाथी chest पे बैठा हो, and हम लोग सांस नहीं ले रहे हैं. It's difficult to breathe, and usually it occurs in the center of the chest or either side, even the right side sometimes, left side sometimes, both sides, and it may spread above and below. Okay, there may be sweating, vomiting, a pale gray skin color, which is cool to touch. So these are the characteristics of chest pain due to heart attack. It starts with moderately severe, but increases. and lasts for more than 10 to 15 minutes. And it's like a pressure not allowing you to breathe, or a tightness. Less commonly, some people get a feeling of gas or lump or indigestion or burning in the chest like acidity. And where do these things occur? The symptoms occur, as I told you, either in the center or either side or both sides of the chest like a big band. Sometimes chest along with throat and neck and jaw pain. Sometimes chest pain with pain radiating both the arms. Sometimes the upper abdomen, mistaken for indigestion. Sometimes only in the shoulder and arms. Sometimes a large area of the chest, neck, jaw and arm. Sometimes the throat, neck, jaws and the arms. Sometimes only in the back. If you get severe pain only in the back, you have to be careful. Okay, it could be a heart attack. So in short, the pain occurs anywhere from the ears to the navel. So supposing you have pain in the legs, or pain below the navel, in the lower abdomen, or pain in the head above the ears, it is not a heart attack. Heart attack occurs from the navel to the ears and on either side of the arms, between both the arms. So this is the areas where heart attack can appear. Now what do we do? What is the action? Don't wait for more than a few minutes. Inform your family members, maybe inform your family doctor, but don't wait for doctors to come to your house. Call a cardiac ambulance or be taken to a hospital. It could be in a taxi, it could be in a rickshaw. Of course, with this COVID, that's the problem, but as safe as possible, reach the hospital. And while going to the hospital, chew a soluble aspirin on the way if you are not allergic to it. So it is a good idea to keep soluble aspirin at home and chew it while you go to the hospital. If your blood pressure is taken and you know it is okay at that time, you can take a nitroglycerin tablet under the tongue. But that is not that important as aspirin. Okay? And go as soon as possible to the hospital because the diagnosis can be made and the treatment can be started. And as we saw, earlier the treatment starts, better it is for you. Your heart can be saved. So complications or a damage after a heart attack can be prevented by early recognition and action and prompt opening of the artery within a few hours of chest pain. Now, another question. Do patients of heart attack get a warning sign hours or days or weeks before the attack? Do they get a warning sign? Well, yes, 50% of heart attack patients get what is known as a trailer before the main movie. What is a trailer? Trailer is lasting for a few minutes. A movie is for 2-3 hours. A trailer is for 10 minutes or 5 minutes. So many times, many heart attack patients, almost 50% of them, get to experience a kind of chest discomfort similar to a heart attack, but shorter lasting and less intensity, maybe 5-10 minutes. It's an unusual kind of discomfort. But these are moments of great opportunity because if you report this to a doctor and he gives you the right treatment, then the heart attack can be prevented altogether. So 50% of patients with heart attack have these warning symptoms. And if noted and reported and treated, then a heart attack can be prevented. So, summarizing, you can prevent extensive damage or death during a heart attack, that means the main movie, by recognition and prompt action. And also you can prevent a heart attack by recognizing the warning symptoms, the trailer, if you see it few days or weeks before the main heart attack. So these are the ways to prevent heart attack or to prevent the complications which occur after a heart attack. Now, heart attacks, are they totally preventable? What is the percentage of heart attacks that can be prevented? Is it 10%, 30%, 75% or 90%? Well, the good news is that 90% of heart attacks can be prevented. And why do we say so? There was a big study called the InterHeart study some years ago, which studied patients of heart attack in 52 countries. And what they found was that there were 9 factors which were responsible for 90% of heart attacks. Factors such as smoking, lack of fruits and vegetables in diet, lack of exercise, lack of alcohol, hypertension, diabetes, abdominal obesity, psychosocial stress, cholesterol, etc. All 9 factors gave rise to 90% of heart attacks, which means that if we took care of all these factors, we can prevent 90% of heart attacks. And the 10% unfortunate who do get a heart attack, we can help them by, as we mentioned the earlier talk, that the earlier reporting and opening the artery can prevent complications. So this is the way we can prevent heart attack or prevent the damage due to heart attack. And the other thing is, out of these 9 factors, 50% of factors can be explained by diet. So diet causes 50% of heart attacks. Okay. So now, how do we prevent heart attacks? Well, I have devised a simple 3-step formula to prevent heart attacks. These 3 steps are few measurements, few lifestyle changes, and few pills if required. Now, what are the measurements that we should do? Measurements are blood pressure, blood sugar, lipids, that means cholesterol, obesity, especially obesity around the abdomen, and your cardiovascular fitness. And what are the target levels, and why do we keep targets? For all these measurement factors, we keep targets so as to know whether we can, by keeping to the targets, we can prevent heart disease. So what about blood pressure? Ideal blood pressure should be about 130/80 and less at home or after repeated measurements in the doctor's clinic. And it's important to know if there are differences between arm blood pressure, left arm and right arm, arm and leg blood pressure, because that gives a clue to the presence of vascular disease or disease in the arteries. Blood sugar हमारा होना चाहिए fasting condition में less than 100 and after a meal less than 140, and hemoglobin A1C, which gives an average of 3 months average sugar, should be less than 5.9%. Okay, these are our diabetes targets or sugar targets. What about cholesterol targets? For a usual healthy normal adult, Indian adult, I would say that your LDL cholesterol, which is the most important cholesterol, should be less than 100. HDL more than 50, triglycerides less than 150. These are the 3 most important parameters. But you must remember that these are not fixed parameters. What is desirable in you may not be desirable in me. For example, if I have had a heart attack, in the past, my LDL cholesterol should not be less than 100, but less than 70 or less than 55. Whereas if you are a healthy person without any risk factors, exercising regularly, no hypertension, no diabetes, no heart disease before, then less than 100 is okay. So the desirable LDL cholesterol level is as per your risk. आप कितने risk में है, आप कितने पानी में है, उसके ऊपर आपका LDL cholesterol desirability होती है. So if you are at very high risk, your LDL cholesterol should be less than 55 or 50. Whereas if you are low risk or moderate risk, less than 100 is okay. So these are the various targets for cholesterol. Obesity. Now, one simple measure of obesity is body mass index. That means आपका वजन in kilograms divided by height in meters squared. And a rough idea is that if you are more than 23 kilos per meter square, you are obese. But this is a very rough idea. It doesn't give you a very perfect idea about the fat content. And that too, the fat content in the abdominal area is the most important. So nowadays we pay a lot of importance to our waist and hip circumference and the ratio between the two. If your waist is lower than the hip, it is much better. If the waist is equal or higher than the waist, higher than the hip, then that is not a good sign. Okay, so waist and hip. And what are the sorry, what's happening? Okay. So the targets are in males, waist better be less than 35 inches and in females less than 31. But more important is the ratio. The ratio should be less than 0.9 in males and 0.8. That means in general, you must remember that the waist should be much, circumference should be lower than the hip circumference, ideally. Now, what is cardiovascular fitness? There are various ways to know fitness, but a simple measure is your walking speed. People who walk slowly, they should realize that it is important that the walking speed increases, and it can be increased. People who walk slowly, they can increase their walking speed and thereby increase their cardiovascular fitness. It has been known that the mortality rate and cardiovascular disease is more in people who habitually walk slowly. So walking speed is an important measure of your cardiovascular fitness. If it is not due to any leg abnormality, if even that should be solved and treated, and the walking speed should be increased. And one of the interesting thing is that the purpose in life is one of the determinants of walking. As you can see, Gandhiji doing Dandi March, his walking speed was quite good because he was driven by purpose always. So life purpose, it has been studied, is one of the determinants of walking speed. So and walking speed determines your overall health. So summary of measurements: blood pressure, sugar, lipids, obesity, and cardiovascular fitness. In some people, we do additional measurements, all these blood tests called ApoB, HS, CRP, troponins, etc. And one very interesting test we do nowadays is what is known as coronary artery calcium score. That means we do a CT scan of your chest and find out whether you have calcium deposits in your coronary arteries. If your calcium deposits are zero, no calcium deposit, that is a very good sign. It is good to have a zero calcium score. But if you have a calcium score which is more than 100, 200, 500, then that means you already have fatty deposits in your coronary arteries. There could be mild blockages, and it's better to take intensive preventive treatment, and maybe start preventive medications also. Now, the few lifestyle changes that are required, as I said, step number 2 are, of course, to stop smoking completely, go on a prudent diet, do regular exercise, and reduce stress levels in your life, and have proper sleep and relaxation. And how do you treat smoking? Well, this doctor tells him that just put a patch over your mouth and stop smoking. No, but there are various methods to stop smoking. And what about e-cigarettes? They were touted as a substitute to smoking and which can help in stopping smoking, but it has its own disadvantages and very serious disadvantages. And we now do not advocate anybody to use e-cigarettes as a replacement of smoking. Best is to stop smoking of any type, whether it is bidi or cigarettes or hookah or anything. Totally stop tobacco and smoking of any kind. Now, what about food? Now, the American government produced this My Plate, which is very interesting because it resembles the Indian thali. And what they advocated and what we should do is divide the plate or the thali into 4 quadrants. One fourth should be full of fruits, 1/4 with vegetables, 1/4 with whole grains, and 1/4 with proteins like pulses, etc. So a healthy dietary pattern is usually a plant-based diet with lots of vegetables, whole grains, legumes, and nuts, and moderate amounts of low-fat dairy and seafood, and very low amounts of sugars, sweets, refined grains, and food with trans fats, meat, palm oil, cheese, desserts, and fried food. So I think going plant food and going vegetarian with some amount of seafood is the, in fact, recently there has been a lot of studies on the Mediterranean diet along with fish and seafood. So that is the healthy food that is good for the heart. And of course, exercise is medicine. It cuts down heart attack risk by 50%. Benefit starts whatever age you start. You are 80, never exercise, you can start gently in the beginning and go up in your intensity, you will get benefited. And like any drug that you take or any medicines that you take, the benefits last as long as you do it. Suppose you stop exercising for whatever reason, the benefits wane off within 2-3 weeks. And what is aerobic exercise? Of course, it is the FIT principle, about 5 to 7 times a week, with the intensity of in which you are just able to talk, but you cannot sing. So if you are brisk walking or running or cycling or swimming, you are just able to talk, but you cannot sing. That is the intensity at which you should do the exercise. About 20 to 30 minutes every day, and it should be aerobic. That means a lot of movement of the body. Now, what about stress? There are lots of stress in the present life, psychosocial, financial, health-related stress. And there are lots of guidelines and articles and books written on stress. I would only mention a few things. Stress comes not only from what we do or what is done to us, but how we respond to it. And how we respond or react in turn comes from how we perceive ourselves. And how we perceive ourselves, when we perceive ourselves only as isolated and alone, apart from the world, instead of a part of it, then we are likely to feel chronically stressed. Chronic stress in turn can lead to heart disease, both due to its direct effect and also through the self-destructive behavior pattern. That means if you are stressed, maybe you would smoke more, take alcohol more, don't care about your diet, etc. So a stress indirectly affects the heart as well as directly affects the heart. Anything that helps us transcend and transforms that perceived isolation can be healing. So getting connected to something or someone is extremely important. This is what was written in Dr. Dean Ornish's program of reversing heart disease, which I recommend to everybody to read. So what are the stress busters? Good relaxation and sleep, physical exercise, yoga, meditation, spiritual literature, reading and company, close and meaningful relationships. They say opening your heart to people or to close people is very healing. Altruism and sense of purpose in life, which all you lions are very much kind of habituated. And that is why people in Lions and in people in my Rotary clubs, I think I have found less disease and less heart attacks because there is a sense of purpose in life. Yoga, of course, leads to meditation. There are different ways in which it helps meditation. And in this person, of course, he's meditating on how to get out. Now, there are other enemies in our midst that we don't pay attention to often. For example, sleeping less. Now, even if you do everything else properly, but if you sleep less, that is dangerous. Sitting more and more. Sitting while watching TV, while driving, while sitting in the car, we are all suffering from a sitting disease. So it would be important that after half an hour or 45 minutes of sitting, we get up, stretch our legs, and also walk more and more and spend time doing work standing. Not having proper breakfast is another risk factor for heart disease because people who don't have good breakfast have a very bad lunch. By the time it is lunchtime, they are very ravenously hungry and they eat whatever they get. So not having proper breakfast is not a good thing. Having late dinner is dangerous because then you sleep early and you eat heavy meals, and many times heart attack comes after a few hours after a late and heavy meal. So these are our enemies which we don't realize often. Now, many times this story also we hear. Doc, my friend had no family history, no diabetes, no hypertension, never smoked, exercised regularly, obese, was careful in diet, not stressed at all, yet he got a heart attack. Why is that so? Well, as I said, 5 to 10% of people are such who get a heart attack without obvious risk factors. Probably it's in their genes, we don't know, or they've been sleeping less, we don't know. But these are the people in whom many times we have to give few pills. That is step number 3 to prevent heart attacks. So many times we have to give these drugs called statins, which lower the cholesterol, and sometimes aspirin, but not for everybody. And of course, pills for blood pressure and diabetes if required, the medical guidance. So the third step is pills. And the most important pill is statins. In appropriate people, when the risk-benefit ratio is such that the risk is more, or the benefit is more of taking the tablet, then one must take the tablet. It not only reduces the blood levels of cholesterol, but stabilizes and regresses the fatty plaque. If your fat deposit hai, that it increases normally, but if you take a statin and take a proper diet, the fatty plaque can regress. So this regression is possible with drugs like statin. So if your doctor advises you after proper discussion and considering your risk versus benefit, then it may be worth taking a statin. So this is the third step in our preventive three-step formula. First step was measurements. The second step was lifestyle changes, and third step was drugs. So prevention with 3 steps can prevent 90% of heart attacks. And if you note the warning symptoms in case you're going to have a heart attack, then another 5% can be prevented. So the last 5% which are unfortunate and get a heart attack, we can help them and save them from complications if they come early to the hospital. Now a few slides on cardiac arrest. What is the cardiac arrest? See, as we saw, heart attack is due to a blocked artery. It is a plumbing problem. Just you have pipes in the house, blocked arteries. That causes a heart attack. But a cardiac arrest is an electrical disturbance. The normal pumping of the heart is preceded by electrical impulse, which rhythmically spreads over the heart and causes it to contract. But when cardiac arrest happens, this electrical system goes haywire, and there is a complete disorganized electrical activity. So what happens in a heart attack is a blocked artery. You get chest pain, you have to open the artery in the hospital. In a cardiac arrest is an electrical problem. What happens is that because the heart stops beating, the blood supply to the brain stops and the person collapses. And if within minutes the brain does not get blood, the person becomes brain dead. And the treatment is to start CPR and give the electrical shock to revive the heart. And where is the treatment to be given? On the spot. So when a cardiac arrest occurs, when you see a person collapse, don't please rush to the hospital. The first thing, yes, you can call the ambulance, you can call for help, but the first thing is to treat the person on the spot. That is extremely important. And then go to the hospital. So treating the person means giving CPR and giving a shock with a shock machine, which is called a AED. Now, as you can see, these are all 3 luminaries. This is Dr. Rakesh Sinha, Sriram Raghu, and of course our beloved past president. All had cardiac arrest, and what was required was CPR and availability of an AED to give a shock to them and to revive the heart. But there was a good news that this gentleman recently means a year ago almost, was walking on the road. Somebody who was not a doctor realized this was a cardiac arrest, knew how to resuscitate the patient, gave massage, called for the shock machine, which was available at Otters Club. Within 10 minutes, somebody brought the machine, gave 2 shocks to him, revived him, and he's alive now. So miracles do happen, but main thing is to know the knowledge about CPR and to have AEDs available at multiple places nearby. So this in short is my talk about heart attacks, and the theme is that no one need have a heart attack or suffer from its dire consequences. I'm happy to announce that I have released a book on romancing the heart. It is an e-book right now, and the print book will be shortly available. And if you have more doubts, you can easily available on Amazon, the e-book, the Kindle book, and it can be read. Of course, when the print book is available, I would be informing you about that. Thank you very much for your patient listening, and if there are any questions, I would take them.
Thank you so much, Doctor, for your very interesting and enlightening talk. You really were so very lucid and clear when talking to us laymen, that we actually understood what you were trying to say. And very few can do that. So before I say anything more, we look forward to everyone's questions so that you can enlighten us further and solve all the small queries people have. I'm sure many have many questions.
Sure.
So, Dr. Sampada, I believe you are coordinating for the questions.
Yes, ma'am.
Can I? Hello? Yeah. Hi. I'm Dr. Snigdha Mehta. I'm lucky to be the wife of Dr. Akshay Mehta and a physiotherapist by profession. And Dr. Sampada has been, I think somebody has wants to have some music on and yeah, thank you. So Dr. Sampada and Sonal Ben have been very kind to forward me all the questions, and we have lots and lots of questions from the audience. So I'm going to start asking Dr. Akshay Mehta these questions. So the first question to you, doctor, is that yoga. Should one do it after a heart attack? Can anybody do yoga after a heart attack?
After a heart attack, one can do everything, even maybe run a marathon, but all depends on how much the heart has been damaged and the medication being given and the gradual progress in activity. Ideally, I would suggest that every patient of heart attack or a patient who's undergone bypass surgery or angioplasty should join a rehab program and a cardiac rehab program, because then your overall fitness improves and you are monitored, you are advised about diet, you are counseled, and you gain a lot of confidence, and gradually you can increase your exercise level, do yoga, do exercise, and I think that's the way to go. Yes, you can do yoga, definitely. But it has to start gradually.
Yeah, thank you. So the next question to you is that when I go for a BP checkup, should I stop my BP medicines before the checkup?
Oh, that's a very important question, because we find many patients come for a BP checkup and they say, no, I have stopped since yesterday because I wanted to know how the BP is. Well, that is not correct, because we want to know how the BP is while you are taking the medicine. So like blood sugar or cholesterol or blood pressure, please do not stop medications when you go for a checkup. Continue the medications and then do a checkup.
Thank you. The next question is that should everyone above 40 years of age take low dose aspirin for prevention of heart disease?
Well, this is another interesting thing, because there was a concept a few years ago that everybody should take aspirin to prevent a heart attack. But it is not so now. We do not advocate aspirin. It can prevent heart attack in patients who are at very high risk, but we have to be sure that the bleeding risk is less, because aspirin taken for a long time can cause bleeding in the stomach, sometimes rarely in the brain. So these are dangerous things. So patients who have high bleeding risk, patients above the age of 75, as a routine, should not take aspirin. Of course, if they have had heart attack before, if they have had angioplasty done before, or had bypass surgery done before, who have established vascular disease, you know that they have disease, yes, then they should take aspirin. But healthy individuals above the 75 should not take aspirin, and below the age of 75, if they have slightest bleeding risk, better not to take. So only selected people we would advise aspirin.
Thanks. The next question is, what's the relation between heart attack, cardiac arrest, and heart failure?
Oh, that's important. So as I said, heart attack is, of course, blockage of artery and chest pain, damage to the heart muscle. Cardiac arrest is sudden stopping of the heart pumping. And when it stops pumping, entire body suffers from lack of oxygen. Maximum suffering organ is the brain, which cannot remain alive after more than 5 to 7 minutes of stoppage of blood. So a person becomes brain dead after 5 minutes. So that is cardiac arrest. And heart failure is that the pumping of the heart is weakened, or the relaxation of the heart is not proper. The heart becomes stiff and cannot relax and accommodate blood. The person complains of breathlessness. So now, how is the relation between the three? Now, as I said earlier, all heart attacks do not cause cardiac arrest. About 25 to 30% of heart attack patients develop cardiac arrest. So cardiac arrest is mostly due to heart attack and coronary artery disease. But there are some people with cardiac arrest in whom the reason is not coronary artery disease or not heart attack. But in those people, the reason is some abnormality in the heart muscle from birth or some electrical abnormality in the heart. They get cardiac arrest. And heart failure, the commonest cause is a heart attack, which has damaged the heart so much the pumping becomes weak. And of course, there are other conditions like cardiomyopathy. People with diabetes have a higher incidence of heart failure. So heart failure is a pumping problem and causes breathlessness. And that is, breathlessness is a sign or a symptom of heart failure. And then of course, swelling of feet and all that. So these are three different things, and one has to understand the relationship.
Thanks. The next question is, Dr. Akshay, your book on romancing the heart is meant for general public, right?
Yes.
And where is it available?
It is right now available as an e-book on Kindle. If you either have to have a Kindle equipment or a device, or even if you have a smartphone or a laptop, you can download the Kindle app, which is for free. And once you download that Kindle app, you can buy that book for about 285 rupees, and you can read it on your laptop or your phone. The print book is still not there. It will come in a week or two, and the print book will be available also on Amazon or with me directly. So if you can inquire me, we'll tell you when the print book comes. But right now, the Kindle book is available.
How obesity is connected and how fat around the waist is connected to a heart problem?
Oh, that's a very good question. People who have more fat around the waist, they secrete certain chemicals which are called cytokines. And these chemicals can rupture a plaque, or all these other thing is that people with increased waistline, they have what is known as insulin resistance. And insulin resistance is a kind of a underlying factor for a lot of things like diabetes, like cholesterol, like hypertension, and what is known as the endothelial dysfunction. That means the arteries are not able to relax and have a greater tendency to develop cholesterol deposits. So the abdomen is a chemical factory which causes these problems. And that is why we insist on having low fat or less fat around the abdomen.
The next question is pretty interesting. Is lack of alcohol bad for the heart?
Yes, that is very interesting. See, alcohol is a double-edged sword. A lot of studies have found it benefits the heart. Now, it has a lot of dangers also. One should look at the dangers also, because it can cause what is known as cardiomyopathy. It can increase your blood pressure. It can cause arrhythmias in the heart. It can cause a lot of cancers of the body. So one has to know the risk and benefit. So we have come to the conclusion that people who have been habituated to having drinks every day, if they drink in moderation, say 1 or 2 drinks, and that too with dinner, keeping in mind that other risk factors are controlled, they are exercising, otherwise observing a proper diet, etc., then we say, okay, they can continue. But people who are non-drinkers, we definitely would not advise them to start drinking because the risks are much more than the benefits. And whatever benefits you get out of drinks, you can get the same benefits if you have fresh fruits and vegetables. So I don't think there is a need to have a drink, and the risks are much more than the benefits. It's only people who have already been drinking without any side effects, without their blood pressure going up. Then we advise them they can continue, but less than 2 drinks a day, and that too have it with dinner, and not before dinner with lot of snacking. Right?
The next question is, can a G6PD patient take aspirin?
Well, I don't know. I don't think you should take aspirin, but we have other drugs which can be taken. If you require aspirin, there are other drugs like clopidogrel, which are much safer from the G6PD point of view as well as from the stomach point of view. So you can take the other drugs, alternative drugs.
The next question is, if a person is alone, what can he do till help arrives in case he gets a heart attack or
Oh, that's
chest
a very
pain?
important question. So first of all, now we have phone somebody. If you cannot get somebody to help you out, see that you reach a hospital as fast as possible. As I said, keeping aspirin in the house is very important. Take a tablet of aspirin, chew it and swallow it, and reach the hospital. Take a cab, take a rickshaw, and reach the hospital, the nearest. And in chest pain, the nearest hospital is the best hospital, because where a cardiogram can be done and treatment can be started, injections can be started. So I think if you are alone, take aspirin and reach a hospital.
The next question is, if I don't drink water post 5:30 p.m., is it bad for my heart?
If I drink water.
If I don't drink water post 5:30 p.m., is it bad for the heart?
No, I don't think so. In case if you have drunk enough water during the day before 5:30, then that is good enough. If you have drunk 6 to 8 glasses of water before 5:30, that should be fine.
How often should we get a checkup done?
It all depends on your baseline risk. For example, if you are age 20, maybe you do it once and then after 5 years or 10 years. But if you are age 30 or 40 and you don't have any risk, there are different things. For example, blood pressure and diabetes, you must check every year. Cholesterol, every few years if your baseline cholesterol is low. But if your baseline cholesterol is already high, then every year. If you have other risk factors like a family history of heart disease, then every year. If you have already had a heart attack or heart disease, then every few months you must have a checkup. So your frequency of checkups depend on your baseline risk. And your doctor can tell you what is your baseline risk and how often you should go for a checkup. But the checkup starts from age 20 or age 18 in our country.
The next question is, statins have too many side effects. Is there an alternative?
Good question. Statins have side effects, but they do not have really so many side effects. I think less than 5 to 10% of people have side. 90% of people do not have a side effect. Well, there could be side effects like muscle pain, etc. And the alternatives are eating red yeast rice, or of course exercise, and diet and exercise. The most important, plant-based diet, for example, can work wonders. And red yeast rice is also an important source of chemicals which can reduce your cholesterol. But if you have side effects with cholesterol, we can change the statin chemical. That means we can change the generic chemical. For example, if you are taking atorvastatin, we can change to rosuvastatin, or we can change to other kinds of statins. And also we can reduce the dose. We can take it alternate days. sometimes, and these methods can reduce your side effects. So if you are advised statin, then if you cannot tolerate it, consult your doctor. He'll find out a method that can help you prevent the side effects.
The last question for today, there are many questions still, but I think we have time constraints. So the last question that I would like to ask you is, does the damaged portion of the heart heal completely post-angio?
Very good question. Fantastic. Yes, the damaged portion, it's a very interesting thing. Many times, even if the heart is damaged, we open the blocked artery after a few days. And the scaffolding provided by the opened artery and these branches sometimes gives a better healing to the heart muscle. The other thing is certain drugs that should be taken after a heart attack. Beta blockers, aldosterone antagonists, and the new drugs called ARNI, ARNI. These are the drugs which can prevent the heart from worsening and heal it better. So a combination of angioplasty and late angioplasty and a combination of drugs can heal the heart better. Yes, definitely.
Shireen Neville has requested one more question. So I'll just ask that this is the final last question. The ECG shows IBD. Though echo is normal, what does IBB indicate?
IBB or LBB? RBB?
LBB.
LBB means left bundle branch block. That means just you have blockage of the artery, in which the blood flows. Sometimes you have blockage in the nerves. You know, just in our houses, we have pipeline which supplies water and we have electrical wires. So heart also has electrical wires. And in one of the wires is blocked or damaged, you get what is known as left bundle branch block, right block. So when you have a left bundle branch block, it is important to get investigated, like do a 2D echo and sometimes do a stress test. And of course, stress tests may not show you any electrical or ECG abnormalities, but it can tell you your effort tolerance. So sometimes, echo is very important. Also, is important to do blood cholesterol, and sometimes it may be important to do your calcium score to know whether you have coronary artery blockages or not. And certain blood tests like TROP-I, HS, TROP-I, etc. So overall risk for heart disease should be more thoroughly investigated if you have left bundle branch block. Otherwise, you don't have to worry.
Thank you so much. I will now exit from the screen.
Thank you so much, Doctor, for your extremely interesting and enlightening talk. And thanks for answering everyone's questions with so much patience and interest. We really are enlightened after this session of yours. And we realize how important it is to change one's lifestyle. Because whilst medicines can improve and cure, but a change in lifestyle, I believe, is most important. Well, Doctor, as it's rightly said, doctors are angels with a white coat instead of wings. And we honestly salute you, angels. With this, I will now request the President of Lions Club of Queensway, Lion Kitayon Daji, to make the announcements on behalf of the twinning clubs. Kitayon, are you there?
Yes, very much so. Thank you, Zenobia.
Over to you.
I'll go ahead with the announcements for all the clubs. Lions Club of Babulnat, having regular meeting on 20th September, that's tomorrow, which is a housing meeting. Lions Club of Baitala, there's a virtual leadership development seminar tomorrow, that is on 20th September at 10 a.m. All members are requested to attend. Second regular meeting for September is on 25th September, next Friday. It will be a fun, frolic meeting and is a dinner meeting. Announcements for Lions Club of Gateway is as follows. On 29th of September, Gateway Club is celebrating its virtual 28th Charter Night. Project at Wangani for blind families, grains, food will be given at a cost of 15,000. Rupees 10,000 for 260 sex workers, family, food grains and medicines. At Pune Orphanage Home, rupees 10,000 for education of a needy girl from Maharashtra School of Science and Technology, and rupees 15,000 donation for pads making machine. Lions Club of Shivaji Park, there will be annual general body meeting. Details will be circulated to members and virtual leadership development seminar on 20th, that's tomorrow, at 10 a.m. Members are requested to attend. Finally, Lions Club of Bombay Queensway will donate a laptop to MMP Shah College for the computer lab established by Lions Club of Bombay Queensway in 2016-17 during October Service Week. Cost for this is rupees 49,000. Thank you. That's all for the club's announcements.
Thank you, Ketayun. I will now request the Secretary of Lions Club of Shivaji Park, Lion Anand Zaveri, to give us the vote of thanks, please.
Thank you. Can everybody get my voice?
Yes, we can.
Okay, thank you very much. Welcome to dear participants and greetings from me. I am assigned a pleasant task of proposing vote of thanks. Vote of thanks is normally proposed after end of formal meeting and before dinner. It reminds us of mouth freshener. It should be small in size and long in fragrance. I propose a hearty vote of thanks to President Zenobia for calling meeting to order and being excellent master of ceremony of the proceedings. I propose a hearty vote of thanks to Falguni for rendering flag salutation. I propose hearty vote of thanks to Dr. Saroj Sanvi for welcoming members in a very graceful manner. I propose hearty vote of thanks to Firoz Kachkar for lucidly introducing keynote speaker Dr. Akshay Mehta. I also propose hearty vote of thanks to Dr. Akshay Mehta for giving a heartwarming talk on romancing the heart. We are really filled with knowledge and action plans. I also extend our gratitude to Dr. Snigdha and Kale. Dr. Saroj Sanghvi and Falguni Sheth will ensure of delivering suitable memento to Dr. Akshay Mehta. I propose hearty vote of thanks to President Ketyani Daji for making suitable announcements. I thank all participants for listening with rapt attention. I especially thank Samir and Sonal for arranging Zoom facilities and coordinating this mammoth meeting. And finally, enjoy the IPL match. If possible, your spouse prepare dinner. Thank you very much. Good night.
Thank you, Anand Zaveri. And now let me thank all the organizers for having arranged this excellent meeting and for having given us an opportunity to hear Dr. Akshay Mehta. It was truly a treat. Thank you. And now, Lions, will you please rise for the national anthem, which will be sung by Lion Adil Besaria. Adil, are you there?
Can you hear me?
Yes. So I think the others should be muted so Adil can sing, and everyone please rise. The meeting is adjourned. Everyone, thank you for attending. Take care of yourselves and stay safe. All the best.
Excellent. Thank you. Thank you, Zenobia.
Thank you. Okay.
Thank you, everyone, for organizing this lovely program.
Thank you.
Thank you.
Thank you.
Thank you, everybody. Thanks a
Zenobia
lot.
and Firoz,
Thank you, Zenobia.
everyone.
Thank you,
very much.
Saroj Ben, for organizing this.
Thank you.
Thank you very much.
Thank you, Saroj Ben.
Thank you.
Thank you, Akshay Bhai, Snigdha Ben.
Hi, Ovi.
Bye. Thank you.
Good night, all.
Bye, everyone. Good night.
Good night.
Good night. Bye.
Bye-bye. Good night.
Meeting. Thank you. बंद करो
अब हमें बंद कर
Crowds on this wicket, if you just joined us, you can come and see us here in the desert.